This makes it the second most common surgical procedure for women in the US. Preparing your body nutritionally before a hysterectomy significantly impacts your recovery and reduces potential complications. It matters. If your doctor goes, you don't need progesterone because you don't have a uterus, get a new doctor.
It is one of the most overlooked pieces, but it is also the most important piece.
Hello, everyone, and welcome back to the latest episode of the Metabolism and Menopause podcast, where we help you understand this new body of yours. Maybe you've started to experience some hormonal symptoms, maybe you're post-menopause, but we know now that your body is inherently different, and those old fat loss strategies just really aren't cutting anymore. So it is time to learn how to work with this new body instead of against it, so you can open up those fat-burning pathways, get your energy back, and feel confident again. So I have one of our incredible coaches here today, Coach Brittany, and we are talking about a topic that comes up a lot. And we're talking all about hysterectomies because you need to prepare for them. You need to know what to expect, how to recover from them appropriately, because that's not really talked about. And there are approximately 600,000 hysterectomies performed each year in the United States alone. This makes it the second most common surgical procedure for women in the US after C-sections, which is crazy. And approximately 20 million women in the United States have had a hysterectomy.
Pretty crazy numbers if we think about it. This is something a lot of people in this community know that this is a subject that is super close to me. It's very near and dear to my heart. I actually myself had a hysterectomy at the age of 35 due to just severe bleeding, endometriosis, adenomyosis. I am going to preface this with hysterectomy is not a cure for endometriosis. We all know that, but I had other things going on and I kind of had walked through the gamut of things and came to the realization that this is the best option for me. But one of the things that, and it wasn't even actually really offered to me, I kind of joked around about it. I came in and I was like joking around. We were like, okay, we've tried that. And I'm like, why don't you just take my uterus out? And my gynecologist is like, we could. And I'm like, oh, maybe we should. And it's not something that's like talked about a lot. A lot of people, you're going to have different doctors look at it different ways as a last resort. You're going to have other doctors that are like, let's just do that. That's the thing that we do, right? But nobody talks about how to prepare for one. Nobody talks about what to expect. Nobody talks about how to prepare yourself for afterwards, just like when we have babies. Nobody really talks about the postpartum period. Nobody talks about the post-surgical period. I personally felt like I was really well prepared for my surgery and for the post-surgical time. But I have a background in nutrition. I have a background in movement and core and pelvic floor health that really, really prepared me for this. But I know that that isn't the case for everybody, right? And to be honest, there are still a lot of things that I wish I had done differently with my surgery, with my recovery. So we're here to kind of chat about all the ins and outs of how to properly prep for a hysterectomy and really set yourself up for success. So first and foremost, I think the most important thing to talk about is we need to prep as best as we can medically, right? So know all the information so that you can best prepare for your specific type of surgery and case. Know your surgery type. There's a total hysterectomy, which is where we take the uterus and the cervix. We have a supracervical, which is just the uterus only. We have it with or without ovary removal, which is called an oophorectomy. And that will drastically affect your hormone needs. So if you're losing your ovaries at the time, you're definitely going into menopause. You need to talk about what does that look like? What does that mean? What can your doctor do to support you? And ask your questions to your doctor. Are my ovaries going to remain intact? Are they going to remain? Is my cervix going to stay? What kind of incision? Is it going to be a laparoscopic? Is it going to be a vaginal? Is it going to be abdominal? There's so many different choices with a hysterectomy. And make sure you get labs done. This is really important. We want to see where we're starting so we can get that baseline. This is especially important for those hormones, right? Your estrogen, your estradiol, your progesterone, your testosterone, your DHEA, your cortisol levels, right? And just getting the basics like that complete blood count, the iron panel, thyroid markers, just all of that, so you have a nice solid baseline to know like where you were starting pre-hysterectomy.
And I think another thing that's, often overlooked is like the emotional side, the mental preparation, because this is one that's not talked about or thought about. And it honestly can be one of the most important ones. We need to acknowledge and process what's happening. Because for many women, the uterus is tied to our identity, creativity, our femininity. If you're getting it out young and what that means for like kids, like there's a lot going on. And so making that space to kind of grieve or reflect, because I don't think people make that connection a lot of the time. Also consider therapeutic support. Consider like a therapist or a counselor that's familiar with women's health or life transitions, because this is a big transition, especially if we're going into menopause after, right? If we're having that total hysterectomy, if we're getting our ovaries removed, there's going to be a lot of things that change. And then doing some like mind-body practices are always helpful, whether that's meditation, doing yoga, some journaling, breath work. For me, prayer and like spending time in the Bible and devotionals, those kinds of things have helped me reduce anxiety and connect with my body. And that can help you during these times as well, because I don't think many people think about the emotional side. Everyone thinks about what's going to change physically, but what changes physically impacts how we feel and how we think and our perception of things. And that does need to be taken into consideration.
Yeah, it really does. It's a huge part, and I think that was one of the biggest parts for me that I felt like I was a little lacking in, even though, I've worked in birth and postpartum and I talk to people about this very aspect of just postpartum support. I never really thought of it as like post-surgery support of like the mindset, how you're going to feel, the spiritual or that energetic preparation, right? So you just mentioned like prayer and scripture, kind of finding that thing that brings you peace that you can kind of dive into that helps alleviate anxiety. Even like thinking about creating some kind of a ritual or a ceremony for yourself, because you are ending a time period in your life. For me, I was 35. I was still able to have children. I mean, I struggled with it, but I technically should still be able to have had children. And that was a really big loss for me. And so putting that down in writing and having closure to that was, for me, I was able to kind of release some of those feelings and thoughts, right? Using visualization can be really helpful. Envisioning a very strong healing outcome, even if you're into like energy healing or Reiki or anything like that, because I think that we can feel emotionally kind of just stuck in things sometimes, and utilizing all those different areas can be incredibly helpful in the healing journey.
And another important part of hysterectomies and really like any other surgery is the prep nutritionally is super important, but never thought about. Your doctors don't exactly tell you about that. And ideally, you do want to start like 4 to 6 weeks before surgery. You might be asking, why is this so important? Preparing your body nutritionally before a hysterectomy significantly impacts your recovery and reduces potential complications. And here's why. So I'm going to list a few of them here. The first is it boosts wound healing. Having adequate protein, vitamins like A, C, and D, minerals like zinc and iron are essential for your tissue repair, for collagen formation, which is going to help your wounds heal quicker post-surgery. It's also going to help strengthen your immune system. Having that proper nutrition is going to make you more resilient against infections and complications that are, typically associated with surgeries. It'll help reduce some complications. Malnutrition and nutrient deficiencies increase the risk of surgical site infections, delayed wound healing, longer hospital stays, and making sure that we have that nutrition beforehand can actually help prevent some of those issues. And that was actually in studies cited by CUREUS, if anyone wants to Google it. Aids in muscle recovery and strength retention. Surgery can lead to muscle loss and weakness due to inactivity. Protein is going to help minimize that muscle loss, support regaining your strength and function afterwards, especially if you are older or we know it's harder to build and maintain muscle mass. Managing inflammation and anxiety. Adequate hydration and foods that are rich in anti-inflammatory properties like omega-3 fatty acids can help reduce inflammation, minimize discomfort before and after the procedure. Your carbohydrates, having that loaded up before surgery. So just like you would load up carbs before a marathon, you load up carbs before a surgery because it has been linked to reduced hunger, thirst, anxiety, nausea, vomiting, and even shorter hospital stays. Supports your bone health. For some hysterectomies where ovaries are removed, a decrease in estrogen is going to affect your bone density. So making sure we have enough calcium, enough vitamin D is crucial for maintaining that bone health as well. And making sure that you have this nutrition beforehand can also help address menopausal symptoms. For those of you who have undergone or are planning on undergoing a hysterectomy that includes the removal of your ovaries, consuming foods that are rich in your phytoestrogens, like your soy products, your flax seeds, those can actually help manage your menopausal symptoms as well.
If we think about it, we're literally thrown into menopause within hours, right? Because those ovaries come out and we lose hormones. So anything we can do pre-surgery to help support that is going to be incredibly important. Going back to some of these specific things like protein, ideally, we're getting somewhere between about 100 to 130 grams daily. This is going to support that tissue repair. Again, some of those anti-inflammatory foods are things like that fatty fish, those leafy greens, those berries, olive oil, turmeric, and then the micronutrients, which we don't really think very often about, right? But things like the vitamin C for that wound healing. So it's those citrus, those bell peppers, those broccoli, zinc, tissue repair again, pumpkin seeds, oysters, beef, magnesium, muscle relaxation, sleep, mood support, all really, really important as we're recovering. But we can get those in avocado and dark chocolate and leafy greens. B vitamins. We want it for supporting hormone detoxification, but supporting mood and energy levels. So eggs, legumes, whole grains, collagen, bone broth, both are incredibly important for connective tissue recovery and gut lining support. If we think about it, we are going to have a lot of medications, a lot of antibiotics on board, and just avoiding like excess sugar, alcohol, processed food, inflammatory oils, all the things that can kind of increase inflammation or lower our chances of recovering really well.
And then we do want to have a focus on detoxification and gut support because it's another very crucial step for preparing for this. We want to help our body as best as it can by supporting the detox systems so that we can see a multitude of benefits. So the first is by supporting our liver. That's very crucial for hormone clearance and just also medication breakdown, antibiotics, all of those things like, you get put under for surgery with to be able to clear all of that as well. Improves your organ function. We want proper pre-surgical liver support because this is something that gets overlooked in every aspect. When we're looking at fat loss, or we're looking at everything. It'll help you get rid of inflammation as well. And so doing things like some gentle stretching, using dandelion or milk thistle teas, cruciferous veggies, doing lymphatic drainage, even some sauna use can really help get your body to clear stuff out in advance. So it's got less to have to worry about, right? This also involves likely taking rid of your alcohol too, which a lot of people don't want to do, but it's a very good idea to do pre-operatively. By focusing on detox, we're also going to enhance our immune system. And a strong immune system is crucial to fight off potential infections that can arise during and after surgery. Studies have shown that pre-surgical wellness programs that include that detox element can significantly reduce the risk of post-operative complications, which we always want to avoid. It reduces inflammation. So those detox methods, by reducing inflammation, can lead to less swelling after surgery, which means less discomfort post-surgery, right? That'll help us so much because we're going to be uncomfortable. We want to minimize that as much as we can beforehand. By addressing detoxification, we're also looking at better gut health because that gut microbiome plays a significant role in our immune system. Influences inflammation as well, and maintaining a healthy gut before surgery can potentially reduce the risk of, again, more post-operative complications like infections. It can improve that healing process. The use of probiotics, which contain beneficial bacteria, are increasingly being considered for their role in surgical recovery, particularly in restoring gut balance after antibiotic use, because we know antibiotics can really break down everything in our gut, good and bad. And that will help minimize bloating. That will help minimize constipation postoperatively as well, which is great because post-surgery, remember having babies? That first poop is terrifying. All I had postpartum, like immediately after, was like soups and stuff and like smoothies, as I was like, I am so afraid to poop. I'm so afraid to poop. So having those probiotic foods like sauerkraut and kimchi and kefir and, your yogurts, prebiotics like onion, garlic, asparagus, having that magnesium citrate, all of those things can really help with your gut health, with your healing. And then also by supporting detox, we're going to see faster recovery. A well-prepared body in general tends to recover significantly faster and more smoothly after surgery than ones that are not.
Mm-hmm. Absolutely. And I'm going to talk a little bit about a piece that is, it's an area I think that we think about a lot, and I think a lot of people do, but we don't always do it properly. So this is kind of that physical preparation piece, which this is equally as important as that nutrient piece that we were just talking about. This is like, we want to work on overall strength, right? We want a strong body because, again, a strong body is going to be supportive of our recovery. We're going to recover faster. We're going to feel better, right? Our body is going to work better. And we want to emphasize that core and pelvic floor strength. We want to avoid overexertion close to surgery because we don't want to like overdo it or burn ourselves out. So really focusing on like 2 to 3 days of strength training a week, making sure we're getting those long rest periods, lots of walking, and no high intensity training for right now. Not saying you can never go back to that, but just right before, we don't want to be doing that, right? And really spending extra time on mobility, especially hip flexor, especially lower back, and then again, core and pelvic floor health. And if we follow the correct exercises for core and pelvic floor health, we can typically use these within the first week or so post-op to help with recovery, to help with bringing blood flow back to the area, which is going to help any incisions. And it can really reduce surgical recovery time. It will help support posture. It's going to help prevent post-op incontinence, which can happen. And then again, just helping to maintain that deep core strength. And again, depending on what kind of surgery we have, that's incredibly important. Maybe a intravaginal isn't going to affect those deep core muscles as much as if we have an abdominal one, right? And remember, the goal isn't six-pack abs. Like, that's not what we're trying to get here. We're trying to get deep core stability. So pelvic floor muscles, they support bladder, bowel, uterus that is actually going to be removed, right? The transverse abdominis, or the TA, which is those deep core set muscles, which kind of wrap around and give us that posture and that it helps balance us. The multifidus, which is the small spine stabilizers, our diaphragm. So our breathing muscle, it works with our pelvic floor, really, really important. If anybody works with me, they all know that I make them do like core and pelvic floor breathing at the beginning of every single workout. And this is the reason why, because it's incredibly important.
Yeah, I always make people do like pelvic lifts and glute bridges to just get everything turned on and stabilized. And we actually have a guide with exercises and videos that we did a long time ago, actually, that I'll make sure to put in the show notes for you, that have the lists and the videos of all the exercises in there, because some of the stuff you might not realize is pelvic floor. It's not Kegels. Believe it or not. You can consider pelvic floor therapy, right? A few sessions before surgery can help with some awareness and some coordination. It can help show you where you might have extra tightness or laxity in specific areas that you can work on. But yeah, doing those exercises pre and post is really important. And we know with muscle mass specifically, the more muscle you have, the shorter your hospital stays are on average, the fewer surgical complications you have on average as well. And so this is where overall strength is important. If you start working out for the first time 6 weeks before your surgery, we're not going to put on muscle mass in that short of time. So that's something to be aware of. But this is something that, if there's hysterectomies in your family and things like that, that might be something that you should more heavily consider right now is, putting on some muscle mass to help support you for that recovery. Which brings us to post-hysterectomy recovery. There are kind of different phases that we go through here. And so the first one is that immediate recovery phase. That's the first 1 to 2 weeks. Here, rest is key. We are prioritizing sleep and stillness. This is where you ask for help. This is where you, just like, when you're a new mom and you might have like your mom come stay with you and help out, or friends come and help out. This is like a pretty serious surgery. Like, you need help. And so maybe this is where you're doing some meal prep and frozen meals and stuff in advance, because this is not a small deal at all. Pain management, there's some natural options. You can have arnica, magnesium, castor oil packs. That's only once your incision has healed. We want to make sure that we are having hydration and fiber to prevent constipation, which is very common, especially with the antibiotics. And so this can be helpful, right? We want to stay hydrated. Practice gentle getting up and down from bed. So this is like the log roll technique to help protect your abdominal wall. So you're kind of rolling onto your side, using your arms to push yourself up, as opposed to trying to do a sit-up. That won't do well. And nutrition-wise, having bone broth, having soft proteins, smoothies helps support your gut. These are easy to digest foods. The bone broth is going to lower inflammation, can speed up healing for your connective tissues. Then adding in some of those fermented foods slowly for gut recovery. The big thing I want to also point out here is that a lot of people want to drop their calorie intake because they're like, I'm not doing anything. And I'm like, no. We're staying at your maintenance calories because your body needs these nutrients to heal. If you try to cut your calories, you are actually going to slow down your recovery. You're not getting the nutrients that you need. And then if you've had a full hysterectomy, you're also having to deal with the whole hormone issue. You need to give your body fuel during this time, because it will make things so much worse if you aren't getting enough food. And we see this all the time. People are sick, coming back from surgeries. They don't want to eat because they're nervous about gaining weight. I'm like, you will actually slow down recovery, increase inflammation, and slow the process, and potentially affect your hormones as well, your metabolism, because your body is under stress. It is working very hard to grow new tissue and heal the site. That requires calories. That requires protein.
Yes, very much. Movement is something I wanted to make sure that we touched on too, because post-op, I think this can be really confusing to people. I think either we feel like we shouldn't be moving, right? I'm scared to move. Or if you feel really, really amazing, which can happen to a lot of people post-hysterectomy, if you have a vaginal hysterectomy, and, for me, like it was a couple of days, but after the first 4 or 5 days, I was like, oh my gosh, I have no pain. I'm, this is amazing. And I was trying to do all the things. And it's like, that wasn't good either. So I think we get one of, each end of the spectrum here. But not moving too much is going, overdoing movement, I should say, post-op can be detrimental to us, but also not moving enough post-op can be detrimental to us. So really, after that first 1 to 2 weeks, it's walking daily, and it's really short distances. I mean, I think the first walk I took was down to my mailbox and back, and it was like, okay, that was it. That was the walking we did today. And then the next day was a tiny bit farther. And it was slowly, gradually increasing that over the course of a couple of weeks. I wasn't doing any heavy lifting for those first 6 to 8 weeks, which was incredibly hard. But at the same time, I knew that I had done enough pre-op, to help support my muscle. Doing some gentle stretching or even restorative yoga once you're cleared. So that's usually anywhere from 2 to 3 weeks for most people. And then adding in some of your maybe favorite pelvic floor moves. I added some in within a couple of days post-surgery, even if it's just that diaphragmatic breathing. So if you go and get that guide that we talked about, there's a ton of different exercises in there. All of those are safe for post-surgery, and practicing them prior to surgery so you know exactly how to do them, how they should feel, but really focusing on connecting with your breath, connecting with that pelvic floor, just making that connection again. That's going to be incredibly helpful. And then, just being cognizant of like scar and tissue healing. So once we're cleared by our surgeons, we can use silicone sheets, or vitamin E and rosehip oil will be great for scar care if we've had like an abdominal surgery. Castor oil packs, again, phenomenal for healing and detoxification. They can even help with fascial release. And then pelvic floor therapy can be incredibly helpful if you find yourself having any tension or pain or just new sensations that are maybe weren't there before, whether that's in your hips, whether that's in your actual pelvic floor, whether that's in your lower back, right?
And also, honestly, I've found when it comes to like fascial stuff and scar tissue, like finding a good osteopath helps a lot because they'll be able to release stuff very gently, because sometimes our body will be very sensitive on scar tissue and it takes time to break it up, and it's better to do it earlier than like later once things are healed up. And a good osteopath can help you with that for sure. Out of all the practitioners that I have on my healthcare team in terms of like a physio and a massage therapist and chiro and acupuncture and things like that, my osteo is like the person that I have the most confidence in, but know that they can deal with things a little bit better and understand my body a bit more just from the training that they've had. And so finding a good osteopath can be very helpful too. Okay, so hormone changes after hysterectomy, because we love to talk about hormones here. So if your ovaries are removed, that means you have gone into surgical menopause. This means there's no slowly easing into it. One day your body's producing hormones, and a few hours later it is not. So your hormones tank suddenly. This can cause your hot flashes, your night sweats, vaginal dryness, mood swings, bone loss, insulin resistance, sleep disturbances. And so you might not be in like physical pain anymore, but now you're dealing with all these symptoms and can feel kind of crazy, to be honest, because you are expecting to feel better in some capacity. But if you get put into surgical menopause, you might not have that like, oh my gosh, I feel so much better, because now you're dealing with these things that were never an issue before. And so what's recommended is bioidentical HRT, estradiol and progesterone. Yes, progesterone. I did a whole podcast on this once upon a time, because historically, and even now, you will find doctors who will not prescribe progesterone because they say the only reason is to counterbalance the estrogen in women in the uterus to help prevent endometrial hyperplasia, so the overgrowth of your uterine lining. If your uterus is therefore removed, many doctors go, oh, you don't need progesterone because you don't have a uterus. But that is so terrible, because it totally ignores progesterone's global effect in your body, because it doesn't just matter for your uterus. Progesterone, uterus or no uterus, is important for literally every aspect in our body, every system. So we have our nervous system and our brain. We know that progesterone is going to convert to allopregnanolone, which helps with GABA receptors. Those are responsible for us to feel calm. They're like an anti-anxiety. They help promote sleep. I don't care if I don't have a uterus. I want all those things. Everyone does. We know it helps with neuroprotection. It reduces inflammation, which we know inflammation blocks fat burning and can lead to disease. It is helpful for promoting myelin repair, supporting nervous system regulation, which also our families would love when our nervous system is regulated, because then we're not so snippy. It's going to help stabilize our mood, reduce irritability, help buffer our stress. It also works synergistically with estrogen to help maintain our bone density by helping to increase osteoblast activity, which is just a word for the cells that help us build bone, because estrogen actually is going to, reduce that bone breakdown. So together, they're very important for supporting our bone density. It's important for cardiovascular health too. Supports vascular tone, has those anti-inflammatory effects within our blood vessels, which will help us keep lower blood pressure. It can help with lipid profile when compared with your estrogen. It's important for your breast tissue. It helps regulate cell proliferation in your breast tissue, which can help reduce estrogen-driven overgrowth, because we don't want estrogen to be unopposed to progesterone. They work together, because then we just start dealing with estrogen-dominant type symptoms and we feel brutal. We know there's going to be an aspect of metabolic function here. It improves your insulin sensitivity, supports your thyroid to help convert T4 to T3. So T4 is like, when you're like waiting for money to go into your bank account, but it's like this weird 3 to 4 day processing. And it's just like somewhere in the world, but not in one account, but not in the other. That's like T4. T3 is like usable cash that you can actually use to pay your bills. I don't care about how much is floating in space. If I have bills to pay, I need cash in my account. And that's what T3 is. It's that cash in your account that allows your cells to go, oh, we can burn fat. And so if a woman receives estrogen-only HRT post-hysterectomy, she misses out on all the benefits of progesterone, which helps us with calming and mood stabilization, our sleep. We know if you get one night of poor sleep, insulin resistance increases by 20 to 25% the following day. That is significant. It puts us at a potential higher risk of estrogen-dominant symptoms in tissues outside of the uterus, like our breast, our brain, our skin. Bone and cardiovascular benefits may be less robust. And so it matters. If your doctor goes, you don't need progesterone because you don't have a uterus, get a new doctor immediately. And special note on progesterone as well, which I talked about in a past podcast, is synthetic progesterones are not the same as bioidentical. They do not have the same benefits neuroprotective-wise or metabolic benefits, and they can actually carry cardiovascular risk. So they are not the same at all. Bioidentical micronized progesterone, oral or transdermal, is molecularly identical to what the body makes and supports the full spectrum of what progesterone actually benefits our bodies. And then, of course, we got testosterone, usually forgotten, but again, vital for our libido, our strength, also blood sugar control, cognitive health. So working with a practitioner who's actually well-versed in menopause, surgical menopause, and understands these things and can integrate it with your nutrition and lifestyle as well to help support everything is ideal, because unfortunately women that we talk to come to us that have had a hysterectomy most of the time are not on progesterone, which is freaking crazy in this day and age. I cannot believe it. So if ovaries remain, many women will still experience some hormonal changes because there's disrupted blood supply to your ovaries. Things change. Your body is different, right? And so we do want to track your symptoms post-op. So how's your energy? Are you experiencing hot flashes? Have your cycles become irregular? How's your mood? All of those things. And then, of course, monitoring with lab work if symptoms arise is always great. That's why we like to get pre-blood work and then get post-blood work as well, so we can see what's the difference, so we know what your body actually needs, because everyone's going to be a little bit different.
After I had my hysterectomy, I went to my post-op appointment and I asked my gynecologist, I said, because I had been doing, natural family planning, so I had been tracking my cycles for years. I was like, so should I continue to track my cycles? And she looked at me like I was crazy and she goes, why would you do that? And I'm like,
oh my gosh.
Because I have my ovaries still, but one of them was incredibly bad and pretty much stuck to the side of my body. So it was it wasn't working. So I only had one working ovary. And I'm like, I know that I'm going to run into issues. But also, how am I going to be able to track those things? How am I going to know what's actually happening? And for a long time, I felt like I was having 2 cycles a month, because it was, and I could feel myself still ovulate, and it was just crazy. And so still tracking your cycles is incredibly important post-hysterectomy. It can really help you identify what's happening, what you're feeling, and then help us identify, is it a progesterone thing? Is it estrogen? Is it testosterone? Just by understanding what's going on in your cycle and where you're at, right? And there's lots of things we can do even without hormones, when we kind of know what's happening in your cycle, right? So yes, ladies, even if you have had a hysterectomy, still track that cycle, because it's really helpful. Yes. So I'm going to talk a little bit about long-term holistic support, because this is incredibly important. I'm 8-ish years post hysterectomy. For actually next month, it'll be 8 years. I had mine right before Thanksgiving. So it's always an easy date for me to remember. But I didn't take care of myself I like immediately post op I did, but not long term, right? I was like, okay, everything's fine. I can kind of go back to doing things. And then I didn't really take into consideration, like, now I'm having hot flashes. Okay, now I'm having this sudden anxiety. Now I'm having these things. And I'm like, oh, it's just life, right? No, it's actually related to not taking care of myself very well and all of the physical changes that actually happened to me post hysterectomy. So, nervous system regulation is so incredibly important. And I know that we talk about that and we expound that here, like to the death, but it is so incredibly important, right? Vagus nerve support. So, things like our cold showers or hot, cold contrast, humming, breath work, feet up, just deep breathing exercises, right? We have a whole entire podcast on it that we've done. And we talk a lot about it in coaching. But, bone and muscle maintenance, right? Making sure that we're doing our resistance training, we're doing our walking, we're doing that vitamin D3 and K2 because we need those in combination. We also need it with magnesium in order for it to be taken up properly in the body. Protein, we need calcium in food. We want to monitor that thyroid, especially if you have hormone imbalances like the PCOS and the endometriosis, right? The thyroid is often like a silent casualty after a hysterectomy, especially if you already have a background with some of these hormone imbalances that I mentioned, right? So, really doing a lot of thyroid monitoring. And remember, there is a hormonal system connection, right? Your thyroid, ovaries, and adrenal glands communicate. It's the HPA, HPT, HPO axis, right? And a hysterectomy, even if ovaries are preserved, will disrupt this hormonal conversation that happens in the body. And this can alter thyroid hormone production, right? That conversion of that T4 to T3 that we were talking about, cellular sensitivity, and like surgery in and of itself is a massive stressor on the body. I don't care how great you recover. Like, that was me. I'm like, I wasn't touched by this. It's fantastic. I did great. No, it came back and bit me hard. Definitely increases cortisol, right? Which can suppress that TSH, lowers that active T3. If your ovaries are removed, right, we've gone into surgical menopause, our estrogen does drop incredibly fast. And estrogen directly affects thyroid hormone transport and receptor sensitivity. So, all things to kind of keep in mind that everything has a conversation in our body and it is all connected. And even with our ovaries intact, right, blood supply and signaling changes after a hysterectomy, and it can reduce ovarian hormone output over time. And that can indirectly affect thyroid function as well.
And so, like, we want to touch on here, why do PCOS and endometriosis increase your risk? Well, PCOS is often associated with insulin resistance, chronic inflammation, and higher rates of subclinical thyroid and Hashimoto's. Stress from surgery can push borderline thyroid issues into overt dysfunction. We see this all the time where people are like basically at this like treading water level, and then some sort of stressor happens, whether it's a surgery, whether it's something traumatic in their life, and boom, now they have these autoimmune conditions. Endometriosis shares autoimmune inflammatory traits with Hashimoto's. There's a higher baseline risk for immune-triggered thyroid dysfunction. And so both conditions can involve estrogen metabolism issues, which tie into our thyroid binding. And so what we see is, these things already kind of predispose you, and then it takes any sort of stress, whether it's surgical or whatever it is, to really push you over the edge. And here you are. And so it's not that you were like doomed to it. It's that your threshold is like much lower for that to happen compared to somebody else. And we have to be proactive about it, which again, people don't talk about this stuff, which is really unfortunate because we see it so often. Men and women who come into our program with thyroid issues is insane. Like when we first started coaching, I never thought that we would see this level. And the more that you learn and the more that you coach, it's like, wow, we are seeing this all the time, all the time. And it's also important to note, like we did about how important progesterone is, and it's linked to thyroid health and support. If progesterone is reduced, which is very common after a hysterectomy unless it's replaced with HRT, that T4 to T3 conversion can drop. That sensitivity to thyroid hormone can decrease, which leads to symptoms even if your labs look quote unquote normal. You guys know how much I hate that. And so often symptoms are going to be overlooked, right? Because it takes on average, women 4 to 6 years to get their thyroid diagnosis, which is insane. Like, that's a long time to be struggling. So then we start seeing the fatigue, the weight gain, the hair thinning, the constipation, the mood shifts, the brain fog, which can all be dismissed as, oh, it's just menopause, which I don't care if it's menopause. I want it fixed. Let's be honest, right? Or like, oh, this is normal post-recovery for surgery. I don't care. I don't deserve to be feeling this way. Let's address it, right? And so a lot of the time, it's coinciding with this thyroid starting to decline. And we did a whole podcast on thyroid not that long ago that you guys can go back to and kind of learn some basics on how to support that better. But yeah.
Yeah. Yeah. And the last piece that I just want to make sure that we touch on again is that mind-body connection piece. So we talked about that at the very beginning of the podcast, how it is one of the most overlooked pieces, but it is also the most important piece. And so really, having that conversation with yourself pre-surgery, pre-hysterectomy, again, whatever that energetic type of work looks like for you, whether that's spiritual based or energy based, incredibly important aspect to bring in, because you need to feel all of the feelings of loss, because they will come up. I mean, trust me, like, I was happy as a clam to lose my uterus because I was like, yay, I'm not going to be dying for 3 weeks out of the month. But at the same time, I was incredibly sad at the same time, because I knew that that meant that I was not going to be able to have children anymore. I knew that, for me, I am very self-deprecating. I will always joke around about things with my husband, but there's always a layer of like, this is what I really feel. And I would make incredibly these like offhanded comments of like, well, guess I'm not a woman anymore. And my husband's like, oh my gosh, I can't believe you just said that. And I go, that's actually how I feel. Like, I lost my uterus. And I know that like, that doesn't make me totally a woman, but like, also I can't have kids anymore. I can't, like all the things that we define as being feminine and a woman. And I was like, it just feels weird. It feels weird to be 35 and not have one anymore. Right. And then I was like, oh my gosh, I think maybe we need to have more conversations about this. And like, I need to actually delve a little bit deeper in that, trauma work. I had a friend who actually had to have a hysterectomy after childbirth, an unexpected one. And I was told by my surgeon, after my hysterectomy, she came in and she goes, your uterus was the size of an 18-week pregnant woman. And I was like, oh my gosh. She goes, I can't tell you how glad I am that you did not have another pregnancy, because we would have either lost you because we wouldn't have been able to control the postpartum bleeding, or we would have done this as an emergency hysterectomy. And that was a little traumatic for me. And then being there for a friend of mine just recently who had to have a post-pregnancy, postpartum hysterectomy, that was incredibly trauma-filled. And so doing some trauma work around this piece is incredibly important and helpful. Doing some pelvic bowl healing. And what that is really just connecting back to your pelvis, right? And making that connection with your breath and learning how to kind of move your lower body again. And also, again, feeling the feelings of what that feels like and just allowing them to be. Any kind of body-based therapy, movement therapy, stuff like that. This is a piece that we often put off, and we feel certain ways and we kind of shove it down and we say that it's not an important part to think about, but it is incredibly important, because this will affect our healing and it will affect our conversation that we have with ourselves and the way that we view ourselves. So,
Is there anything that you wish personally that you would have done differently pre or post for your hysterectomy?
I really feel like I feel like I had the nutrition piece down. I feel like I had the movement piece down because I lived in that for a long time. And I really did. I took 6 to 12 weeks pre-surgery to really nail in nutrition, nail in, things that I was like, okay, I'm not eating enough of that. Let's get that in there. Okay, let's really focus on pelvic floor work. Let's get sleep a little bit more in order, like that kind of stuff. for me, it was probably the emotional aspect that I wish that I had done differently. And again, like I sit here and I joke and I'm like, yeah, I was super happy because, I wasn't bleeding, literally 20 days out of the month. But the other side to that is I was incredibly sad. I actually put my surgery off once because I was so sad by the whole entire thing that at the last minute, I thought it wasn't the right choice for me. And I was like, no, I'm not going to do it now. I can't not have a uterus because, you know, I, I just, nope, can't do it. And then I was like,
Mhm.
I went through another month where I was just, you know, on the floor in pain. And I'm like, okay, I have to do this. Like I can't live like this either. So for me, I really wish that I had actually done some therapy prior to. I've done some after. And it has helped me a lot to process kind of, what I was told, you know, uh, if I had gotten pregnant, what probably would have happened. The feelings that I have about myself having a hysterectomy, like I had a vaginal hysterectomy. And so I have a cuff. I don't have a cervix anymore. And I used to always joke around with my husband. I felt like it was like a tube sock, at that point, because you don't have the cervix, and he's like, oh my gosh, you literally are so mean. And I go, these are things that I actually feel like they sit in my brain. And I really wish that I had actually had that conversation beforehand
Mhm.
and immediately after with a therapist, like who could help me break that down and help me actually like process all that stuff instead of letting it sit in my body
Yeah,
and in my brain.
I think a lot of people don't think about that at all, to be honest. I think a lot of people just think it's just a surgery. Oh, I'm just getting my appendix out. Like it's just any other kind of thing. And so I think it is important to take the extra time for the mindset piece because it does affect us way more than we ever think that it will. Thanks, Britt, for sharing your story. I really appreciate you being so like open about that. And I think this is something that a lot of people will be able to relate to, whether they've had one or, it's been broached as a topic so they can prepare a bit better. Because like we said, I think a lot of people think it's just like any old surgery, or I'm just getting my appendix out, or it's no big deal. And I don't think a lot of people realize it till they're there and it's happening or it has happened, that it's like, oh my gosh. And then you start wondering if it was the right decision and all those things, especially if it means surgical menopause as well. So thanks for sharing your experience. And I really hope that this helps a lot of people. And if you want that pelvic floor guide, it is in the show notes for you. I'll make sure it's there for you. And if it happens to not, just email me and I'll send it over to you. Okay. Thanks, everyone. Bye.